Dr. Amanda Pennington, thank you for joining us today and welcome to our Business Owner Spotlight. It's been really cool getting to know you over the last couple of months, and just really looking forward to having you spend a little bit of time and share with us a little bit about your practice, your business, if you will. Maybe you can just tell us a little bit about Pennington Primary Care and what makes it different.
Thanks, Mike. Well, Pennington Primary Care is a primary care office, but it's different from the traditional primary care. We operate under a model called direct primary care, and basically the difference is in the way it's billed and the payment. It's directly between the physician and the patient. There's no middleman. There's no insurance or corporation or anything between me and the patient. And that makes it different on several levels. One of the things that happened when primary care started being covered by insurance was that the cost of primary care went up significantly. And there were a lot of people that couldn't afford primary care if they didn't have insurance to pay for primary care. So when we take that middleman out, I found that I could deliver primary care to those people who either couldn't afford insurance or had insurance with high deductibles, care that was more transparent in pricing. So that's kind of how I came about being interested in the direct primary care model.
That's really cool. And, I think most people probably had the experience too, where they visited the doctor's office, and especially more and more lately. And the doctor, they're just looking at their watch the whole time because they've got to get from patient A to patient B, because the model, at least the way I've heard it, is I'm not the customer. The insurance company is the customer, right?
Right.
And the doctor has to keep the insurance company happy and hopefully take care of the parent or the patient in the process. And how has that, now I know that you had come from a model like that, right? You worked in kind of a classic medical practice. How has that been different for you? How has that changed that client or patient interaction?
It's probably one of the biggest differences patients notice. Those 10-minute appointment slots, when a lot of the time is taken up trying to click boxes and satisfy metrics and that sort of thing, there really isn't a lot of time left between the physician and the patient. In my office, our office visits are a minimum of 30 minutes, and our new patient visits are an hour. So we really spend time getting to know you. It came to a place where a lot of offices now will only let you have one problem discussed when you're there. And if you have more than one problem, you have to make another appointment, wait your 2 hours to be seen, pay your copay all over again. And I felt like that wasn't the way to treat people. And I think this is a better model.
Is it fair to ask you a question about overall cost? Because you mentioned insurance and payments directly. So is it accurate that y'all don't accept insurance at all, or is that inaccurate?
Correct. We bill no insurance. We accept no payment. We, however, accept anybody who has insurance. You're welcome to use your insurance where the stuff costs a lot of money, at the hospital, the specialist office, the CT scanner, those places. But in my office, we keep the cost down. Yeah. And it's a membership or subscription type, like your gym membership. And our fee starts at $57 a month.
Oh, wow.
And it goes up to $85 a month. And there are family discounts and there are children discounts. Children with a paying parent, we don't accept children without a paying parent, but children with a paying parent are $12 a month. So it's very affordable for a family. And with that subscription, you get your primary care covered. There's no copay when you come in. There's no office visit when you come in. There's no billing codes, none of that. You need to be seen for a sore throat, you come in and be seen. You need your sports physical, you come in and be seen. You need a wellness exam, your diabetes followed up, your stitches because you cut your hand. We do all those things, and there's no additional copays or fees for that.
That just sounds like such an amazing value. Is it just a matter of getting the word out? I mean...
So I think so. And I think a lot of people still haven't gotten past, well, I pay for this insurance and this insurance is going to pay for my primary care, so I must use my insurance to pay for primary care. But I have a lot of people who figured it out now that have insurance, and they still save money by using me for their primary care. Especially when you have a high deductible, because you go in for a visit and say you have a sore throat and they order some labs and you haven't met your deductible and you pay your copay at the time of the visit, but down the road you get another bill for these things because your deductible wasn't met. And I have contracted with pricing for some of those things that even your labs are significantly less, and you know at the time, this is how much they'll cost if you get them with me. We can have the lab submit it to your insurance if you want and get that bill. But chances are when you get that bill, you're going to wish you had done this, and we can't go back and change it once we've ordered it. You know, and some things I just include in the cost. A strep screen, I don't bill for that. If you need a throat swab, we do throat swab. If you need an EKG, we do an EKG. There's no procedure fee for that.
Wow. That's really amazing. I mean, when I think about what we pay for copays alone, we're probably pushing the envelope on $50 to $100 a month if you annualize it, I'm sure. Mm-hmm. So, and I know that we've had those experiences where my son had what they thought was a broken arm, which is something he's rather good at. He's up to 3 now, but none of them were actual breaks. It was on the growth plate, and it was $800. $800. He didn't have a broken. We don't think he had a broken wrist, but it was on the growth plate, and we had no idea going in that it was going to be $800, and it was just a hard cast for 4 weeks. And, you know, we tried another solution the next time he broke his arm, or thought that he did, and went to a different doctor, and it didn't end up being $800. So I think that's also part of the challenge, isn't it? Is people just don't realize it's that sticker shock, Amanda. The patient doesn't know what they're paying until they're already committed. And right. That's our frustration.
And we try to be very transparent. We have a few things that we charge for in addition to your membership fee. One of them is your labs, but we tell you up front, when we order labs, this is what your lab bill is going to be.
Right.
We dispense medicines. I dispense generic medicines in-house. And if I dispense your blood pressure medicine for 3 months, I tell you that's going to be $2.89. Yes, I said $2.89 for a 3-month supply. I have medicines that are that inexpensive.
Right.
And so even some patients who have insurance, if their insurance covers their prescriptions, we send their prescriptions to the pharmacy. The pharmacist bills the insurance, and the patient has the medicines covered by insurance. Even then, sometimes their copay for their medicine, after their insurance pays what their insurance is going to pay, they still get a better deal if they get it with me. And I don't have a big markup on my medicines. I don't make money off of that. That's a value-added service to my patients. So it doesn't matter to me. If you get a better deal at the pharmacy, use the pharmacy. If you get a better deal from me, we'll do it with me.
One question that I think, you know, is really important right now that a lot of people might be thinking about is if they're thinking about coming to Pennington Primary Care for their medical needs, you know, what types of steps do you take? You know, obviously you're a physician, but what type of steps do you take to make sure that people don't get sick in the waiting room, or just what are some of the things they need to know about that you're doing to reduce their risk exposure?
That's a great question. And believe me, we have considered it. Right now, if you want to join Pennington Primary Care, your first visit is going to be a virtual visit, and we'll set you up to talk to you, do a video, get your history, learn about you, and what your needs are. And then depending on the urgency of those needs and whether it's something we need to bring you in the office, we can do that, or set you up for a blood draw, or say, you know, I think for now, let's refill that blood pressure medicine, and in a couple of months, we'll bring you in when things have settled down a little bit. You know, people are getting out more, places are opening up and bringing people in more. And so we do have procedures in place to keep you safe and have all along. For my sick patients, I have been doing car visits. So I'll put my mask and gown and hat and everything on and go out to the car and swab your throat, or stick the swab down your nose for a test, whatever we need to do to keep everybody safe. For people that we think are well and can come into the office for more of a well type visit, we're asking people to stay in your car. We'll text you when you can come up. We'll check your temperature at the door, and then bring you on back and take care of you. If you're sick and need to be seen, but it's not something that we think is a COVID sickness, we still have plans in place to bring you in. We bring people in one at a time. We gown and glove as appropriate. We're asking everyone to wear their mask when they come in, and we will be in masks. And then we sanitize everything down as people leave and the next person comes in. So we are taking the precautions that are necessary to keep everybody safe.
You mentioned a little bit of it in the beginning, but what are you finding are the people who are really benefiting the most? You mentioned high deductible. Are there any other life circumstances or types of people or anything that really are people that generally you can help out?
Well, I think one of the groups of people that this is really good for are the people who are working,
mm-hmm.
don't have a job that offers an insurance plan, so they don't have insurance. They have a job, but they don't have an insurance. But if they go to a traditional office that sets their prices based on the insurance model, those office visits are very expensive. Or if they can't get into an office because the office is full, they're not accepting new patients that don't have XYZ insurance type, then they're at the mercy of going to the urgent cares or the emergency room when they get sick or they need primary care. And it's very expensive there. So
yes.
For those people who are working but don't have insurance, this is a great way to get your primary care. For people who have insurance with a high deductible, it still works very well. And then for those people who are just frustrated by the wait times to get in to see your doctor and then being rushed through the appointment, or not being able to see your doctor because your doctor has too many patients on their panel, so they say, well, you can see this provider instead, or why don't you go to the urgent care that's affiliated with our office because we're all in the same system and that'll be just as good too. And I think people get frustrated with that, and so we work well for those people too.
Yeah. Talk to me a little bit about wait times. So, I mean, I hope you don't take offense to this, but going to the doctor's office for many people is kind of like, at least old school, flying on an airplane. You just don't expect it to be a great experience. I mean, is that true? I mean, flying on an airplane, you expect it to be a hassle to check in, to check your bags. It's probably going to be delayed. You might get in late. And if it goes well, you're just ecstatic. So the level of expectations for the airline industry is really low. And I think, unfortunately, especially in recent years, that's becoming, I know that my experience has been longer and longer wait times. So maybe you can speak to that a little bit. How does your model address wait times and customer service?
So now for me, for a new patient, if you've never been seen before, there is a little bit of wait because my practice is full. I have, however, hired someone else who works with me, and she has an open schedule. And so she can get new patients in same week usually. So that's pretty good for a new patient appointment. For my established patients, if you're already in my established panel and you're sick and you need to be evaluated by me, we can usually do that same day or next business day. It's not always in office. Sometimes it's a video visit like this. Sometimes it's a text message. I've had people say, I've got this bump on my eye. I'm not sure what it is. And I say, send me a picture. It's a sty. This is what you do about it. You don't take half the day off work to come sit for 2 hours in the doctor's office to be told you have a sty, put some warm compresses on it, right?
So it sounds like, obviously you're evolving with technology then as well. You're doing the virtual visits and things like that.
And that's really worked out nice during this pandemic because we put some of that in place. And so we weren't scrambling, trying to figure out how do we do virtual visits? How do we code for them? How do we bill them? Is insurance going to pay for it? It's already included in the membership and has been from the beginning.
Right. And then obviously you have a full staff, and you mentioned you've hired another doctor, so it's not just you. Anything else that you think would be important to the public that you'd want them to know about your team or your practice?
Well, I think we have a great team. And I asked my patients, kind of in preparation for this interview, what do you think sets us apart?
Yeah, share that with us.
And they said it's that personal approach, that that we get to know them, the team gets to know them. My patients and staff get along so well that it's fun to watch their interactions. You know, I'll have a patient come in, they don't have an appointment, they come in because they have a recipe they want to share with Ashley. Or they've stopped by the vegetable stand and picked up a bucket of strawberries, and they bring them in because they want to share it with us, because they just feel like we're part of their family too. And I've had other direct primary care doctors say that having a direct primary care doctor is like having a doctor in the family.
So, you know, maybe this is an oversimplification, and I'm not that old, so I don't remember this, but you see it in movies. But this almost sounds like the Doc Hollywood, you know, where you had the local doctor in your community and everybody knew them and they were part of the community and they did whatever they needed to do. And it wasn't this big ordeal. Is that fair?
Old-fashioned medicine with a modern twist.
Exactly. There you go. I like that. Old-fashioned medicine with a modern twist. So speaking of old-fashioned, how long have you been doing this now? I guess two questions. How long have you been practicing medicine? And then how long have you had your personal practice?
So I have, I've been board certified in family medicine for over 20 years.
Wow.
Practiced in the Rock Hill area just about that long. And it was January of 2017 that I opened my direct primary care practice. If you're looking for a more personal relationship with a physician, that direct primary care is a good way to do that. If you are struggling with being able to pay for your primary care with or without insurance, that direct primary care is a good way to look. And also, it's a good place for small business owners to have primary care coverage for themselves and their employees at a reasonable price. So I think it works in a lot of situations.
As you well know, I work with a lot of small business owners, and they're not big enough yet, possibly, where they can afford a company healthcare plan. And then even if they do have one, the small businesses, it's likely to be a high deductible plan, and they're probably only paying a portion of the employee's premium. So yeah, that's a conundrum that comes up quite a bit.
I do have a small business that I take care of, and I made a stop by there not long ago to take them some masks, because they're a business that is essential. And I talked to the owner. He said, "What do I need to be doing to make sure my employees are safe?" We talked about various things, and I said, "I've got some masks. I'll bring some by." And so I went by with some masks. And when I did, they kind of gathered around. And so I just had an impromptu 30-minute discussion on safety and COVID and that sort of thing. And it was really awesome.
That's so cool. One of the questions that I had written down a little bit earlier was, are there any services that you provide, or maybe what services do you provide that people might be surprised that you provide? So it's something that you treat or something that you do. I mean, that's one of them. I wouldn't have expected that you would be willing to come out and talk to a business owner's team about the safe use of masks or how to minimize COVID-19 risk.
Right. So we certainly can do things like that. I have made house calls. It's limited, but it is something that I can do. We do minor procedures in the office. Joint injections, sutures, toenail removals, skin lesion removal, and all those procedures are covered in the membership. There's no additional fee for those. Now, if we send it to pathology, there's a pathologist fee, but I've worked out a deal with the pathologist, and we know up front this is how much it's going to be for the pathology. So, so those things are included. I think one of the things that surprises people is that on your first visit, we give you a communication guideline, and it's got a phone number where you can reach me by text or phone after hours. And you've got an email that you can reach me anytime. I don't answer the email within 5 minutes. And a part of those guidelines, we set out the expectations that, you know, if it's urgent, this is how you contact me and how soon you can expect a response. And if it's not urgent, this is how I'd like you to contact me and when you can expect a response. I think people are surprised by that you're given, this is the phone number, use it if you need it.
Yeah, that is really amazing. You don't get the personal phone number of the CEO or the, yeah, it's hard to get a phone number. Try and call Amazon sometime. Talk to us about where you're located, and if people want to find out more about your practice, of course, we'll include some information with this interview, but maybe just tell us about where you're located and how to get a hold of you and your website and all that.
Sure. We are at the corner of Ebenezer and Herlong, behind the Hardee's and Starbucks, in that complex there. We're in Suite 205 on the second floor, and there is an elevator. We have a website, penningtonprimarycare.com, and there's a lot of information there. There is all the fee schedule. You can find out the fee schedule, all the benefits that are included with your subscription fee. It's all on there, as well as an email link, hello@penningtonprimarycare.com, where you can email and ask us questions. And I'm one of the folks that opens those emails and answers them personally. So we also offer a complimentary meet and greet visit. So if you're still not sure how this would work with you, or you just want to meet us in person first, we do offer that. I tell folks for that first visit, bring in your receipts for the past year. How much, figure out, what did you spend on primary care the past year? What did you spend on your prescriptions the past year? What did you spend on your labs the past year? And we can show you what how our prices compare, so that question of, well, if I'm already paying for insurance, how can I pay for the subscription? Sometimes it pays for itself.
Yeah, I can see where that would be the case. That's a really good idea too. Just have people come in, do the math. That's what I tell folks a lot of the time. Well, super. Such a pleasure talking to you and learning more about your practice and why you do what you do and the type of people that you help. It sounds like an amazing value and a great contribution to our community. And I just want to thank you for being here on Business Owner Spotlight. I could call it Business Practice Spotlight as well. And hopefully you found it to be enjoyable as well. I'm sure our viewers will love to have an opportunity to watch this and learn more about what you do. So thank you so much.
Thank you.
And I will look forward to talking with you soon.
Okay, thanks, Mike.